Today we're tackling a really big topic, social media.
Mm,
It's just so woven into, well, everything we do and increasingly into our health.
absolutely.
You're probably, scrolling or checking something even as we speak. But we want to get past the surface level stuff today.
Right. Beyond the likes and shares.
Exactly. To really understand its role, its actual impact on public health.
Yeah, and we're not just riffing here. We've got some solid sources for this deep dive.
Okay.
We're looking at a narrative review from PubMed, which pulls together a lot of research. Then for scale, like how many people are using this stuff, we've got stats from PwC, Infographics Archive, and Statista.
Gotcha. So the usage numbers.
Yeah. And crucially, we've also reviewed guidelines for groups like the AMA, the ACP-FSMB, and OPA regulations. So the professional side, too,
Okay, so we're a pretty broad look.
Yeah.
And the mission today
is really to pull out the key insights. Understand how social media is shaping public health, the good, the bad, across different parts of the health world.
All right, let's get into it. First things first, what exactly is social media in this context? What are we talking about?
Well, the review defines it pretty broadly. It's online social networking sites. So think X, formerly Twitter, YouTube, TikTok, Facebook, Snapchat.
The usual suspects.
Right. Reddit, Instagram, WhatsApp, even blogs sometimes. It's all seen as part of Web 2.0. And the key thing they mention is it's an ever-changing field,
Always evolving.
constantly. What's popular today might not be tomorrow. That's important background.
You mentioned Web 2.0. Maybe just quickly, what does that mean for people who aren't familiar? What's the core idea there?
Sure. Basically, Web 2.0 means the internet became more interactive. It wasn't just websites telling you stuff. It's about users creating content, sharing, collaborating.
Right, user-generated content.
Exactly. Social media is kind of the prime example. We're all putting stuff out there, reacting to others. It's a two-way street, or, well, a many-way street.
Makes sense. And that interactivity, that access, is a huge point in the review, isn't it? The potential it creates.
Oh, absolutely.
Yeah.
Just the fact that so many people have internet access, often on their phones, opens up massive potential for getting health information out there, making it accessible.
Yeah, I can see that.
And it goes beyond just access. The review highlights some real positive impacts on public health itself.
Like what? What are the upsides?
Well, one interesting area is disease surveillance.
Okay, how does that work?
Think about tracking flu outbreaks, for instance. You can get clues from what people are searching for, what they're posting about, maybe even anonymized location data.
Ah,
It can potentially supplement traditional reporting.
wow. Okay, so like an early warning system almost. Real-time population health data.
Kind of, yeah. It gives public health folks another potential tool to see what's happening, maybe spot trends faster.
That's fascinating. What else?
Health education is a big one. Social media can be incredibly powerful for getting health messages out, public health campaigns, raising awareness.
Yeah, you see that all the time, like short videos explaining things.
Exactly. Think about a catchy TikTok video on vaccinations, or a really clear infographic shared on Instagram about diabetes management. The reach can be enormous compared to, say, just pamphlets.
Definitely a different scale. The review also mentioned using social media for health research.
Researchers can tap into this huge amount of data people generate online. Posts, discussions, expressed attitudes about health topics.
So analyzing what people are saying and doing online.
Sort of, yeah. It can help identify patterns, understand risk factors, maybe even find participants for studies, especially for groups that are harder to reach normally.
Interesting. So the online interactions themselves become data?
Yeah.
And health and behavioral modification, how does social media fit in there?
It can create supportive environments. Think about online groups, right? People trying to quit smoking or manage weight loss or live with a chronic illness.
Support groups, basically.
Yeah, but potentially much larger and more accessible. That shared experience, the encouragement, it can be a really strong motivator for sticking with healthier habits. Peer support, but amplified.
Right, that makes a lot of sense, the power of community. And it seems this influence can even reach up to, like, policy level.
The review suggests so, yeah. Social media can be a tool for advocacy, raising awareness about health policy issues, mobilizing support, maybe even directly engaging with politicians or policymakers.
So it gives people a platform to voice concerns and maybe push for changes in health laws or regulations.
Potentially, yes.
Yeah.
It can amplify voices. Another area mentioned, which I thought was interesting, was enhancing professional development for healthcare workers.
Oh, how so?
Well, doctors, nurses, other professionals can use platforms to connect with colleagues, share knowledge, discuss best practices, stay updated on new research.
Ah, so like online communities for docs and nurses.
Precisely. Sharing cases, asking questions, learning from peers across the country or even the world. It breaks down some of those old geographical barriers.
Fosters a more connected medical community.
Okay. And lastly, on the positives, the review mentioned the doctor-patient relationship. Sounds complicated. It definitely is. It's evolving. Social media offers new ways for doctors and patients to maybe communicate, but it also brings huge questions.
Like boundaries.
Exactly.
Mm.
Professional boundaries. Patient privacy is massive. The whole ethics of giving advice or interacting online in that context, it's forcing a rethink of traditional norms.
Yeah, you can see the potential pitfalls there. Which brings us neatly to the ethical side, the professional responsibilities. The review flagged this as important.
Very important. It specifically mentioned findings on the ethical, professional, and social implications.
Yeah.
And it referenced key guidelines. You mentioned IPAY earlier.
Great, the privacy level.
Yeah, the Health Insurance Portability and Accountability Act.
Yeah.
Basically protecting patient health information. And on social media, that means being incredibly careful. No posting anything that could identify a patient, even accidentally. The consequences of a high PI violation are serious.
Absolutely critical. And there were guidelines from medical bodies, too.
Yes. The review mentioned the American Medical Association's policy on professionalism in social media, and also guidelines from the American College of Physicians and the Federation of State Medical Boards about online medical professionalism.
And what's the gist of those?
The core message is, maintain professionalism online, just like you would offline. Be mindful of your digital footprint, don't share inappropriate stuff, and always, always respect patient confidentiality. The same rules apply, basically.
Makes sense. The medium changes, the standards shouldn't. Now, the review also pointed out something interesting, that even though social media is helping people with health, it's still, like, debated.
Yeah, it notes that this is still an area of ongoing discussion. Different opinions exist. It's not presented as a simple good or bad thing.
So it's complex.
Very. It highlights that we're still figuring out the net effect. There are clear benefits, clear risks, and a lot of nuances in between. It needs ongoing study.
Okay. And just to ground this discussion, the review gave some sense of how many people were talking about using these platforms. Any specifics there?
Yeah, it referenced a figure one in the source, showing the most used networks globally around January 2022. It ranked them by monthly active users, millions of people.
The exact numbers change fast, I guess.
They do constantly.
Mm.
But the main takeaway is the sheer scale. We're talking billions of users globally across the top platforms. That massive reach is why it has such potential influence for good and, well, potentially otherwise, in public health. It showed numbers in millions and the percentage share for the big ones.
Right. That scale really underlines why this conversation matters. And finally, did the review highlight any sort of recurring themes or keywords?
It did. The keywords mentioned were HELNAPE violation, public health, social media or SM, social media platforms, and Web 2.0.
Okay.
Which really summarizes what we've been talking about, the tech itself, the health context, the legal framework, the professional aspect. It ties it all together.
So let's try and recap this deep dive then. We've seen social media, this ever-shifting digital landscape offering some really powerful tools.
Tools for public health.
Right, for things like tracking diseases, educating people about health, doing research, maybe even shaping policy.
And supporting behavior change, professional development. Quite a list.
But at the same time, there are these huge ethical and professional guardrails needed. IPAY professional guidelines.
Absolutely crucial. And that ongoing debate about whether overall it's a net positive for achieving health goals. It's not straightforward.
No, definitely not. It's this powerful force with, like you said, big opportunities, but also real challenges.
Precisely. A double-edged sword in many ways.
Okay, so that leads us to our final thought for you, the listener. Thinking about how fast social media changes, how it's just getting deeper into our lives, where should we really be focusing our attention? What are the critical things we need to get right to make sure it's genuinely helping public health while also managing those risks, especially around, professional ethics and making sure reliable information actually gets through all the noise online?
Yeah, in such a fast-paced digital world.
It's a huge question, something that's definitely going to shape how we approach health moving forward. Thanks for joining us for this deep dive.